Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please note that Dr. Ahmed is away and we will not be having our weekly epi summary report, but the information will be posted to our website, which will be including the doubling time and the R0 value. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into your sleeve or a tissue, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 175,599 confirmed cases of COVID-19 in Canada and 55,945 cases in Ontario. Chatham-Kent has 371 cases, and Sarnia-Lambton has reported 347 cases. Michigan now has 132,039 cases, with 14,641 cases being in Detroit. Today, we are reporting 2,710 cases of COVID-19 since March, an increase of 21 cases from yesterday. 17 cases are agri-farm workers, 3 are close contacts of confirmed cases, and 1 is still being investigated. Overall, 26% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39 years. 2,577 cases are resolved, and 57 cases are active and being followed by our health unit. 2 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is currently 1 outbreak in the agri-farm sector. Symptoms of COVID can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Testing is available by appointment at select pharmacies in Windsor with specific criteria for people without symptoms. Please contact Shoppers Drug Mart Pharmacy for further information. Testing is also available by appointment at the assessment centres in Windsor-Essex. Testing at assessment centres is for those with at least 1 symptom of COVID. High-risk contacts as directed by our health unit, and workers or residents of a facility experiencing an outbreak as directed by our health unit. Windsor-Essex has 3 assessment and testing centres: St. Clair College Sportsplex, Windsor Regional Hospital, Olette Campus, and Deary Shores Healthcare in Leamington. And SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. We have been asked about testing and the number of tests being completed in our area. From September 27th to October 3rd, there were nearly 5,000 tests completed, with a daily average of about 700 tests. For the past week. The percent positivity for last week was 0.7%. And in the past week, 64% of the results have been available within 2 days of the test. Overall, more than 111,000 tests have been completed in Windsor-Essex since the start of the pandemic. Please continue to visit our website at we2.org for further information. Please note that starting next week, we will be shifting to a new schedule for our YouTube live updates, Monday, Wednesdays, and Fridays. We hope you enjoy this Thanksgiving weekend, and we will be back here on Wednesday morning at 9:30. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Just to note that our manager of epidemiology, Ramsey D'Souza, is also on the line. We'll start with CBC.
Good morning, Teresa. So can you give us more information about what happened at this farm and why this outbreak had gotten so large?
So we were aware of 1 case in the farm, and we, as is our practice, we would look at the close contacts, which are essentially in bunkhouses. And so all of the high-risk close contacts would be isolated and also tested. And it's a result of that testing that the numbers have increased so rapidly.
And with all the precautions that under Dr. Ahmed's Section 22 order, how is it that it was able to spread so quickly? Is it because they all share living accommodations?
Well, people in a bunkhouse, when there's a group in the bunkhouse and we know that the physical distancing is difficult and that the close quarters put you at a higher risk of spreading the virus if you have it. So one case can spread quickly to close contacts. We are working with the farm, and our inspection team has been out there, and they do have good practices in place, but the accommodations and the spread of the virus to immediate close contacts is what's increased the numbers in that accommodation setting in that bunkhouse.
Are you expecting more cases to come because of this outbreak?
We will be doing more testing, but so there could be more, but we'll see how things progress next week.
Thank you.
Any questions from Amy 100?
Teresa, I'm not sure if you can get into this, but the one case, like you mentioned, is that individual new to the region, or has he or she been at the farm for a while, or is that one of the travel-related cases?
This is not a travel-related case, so this is a case that was on the farm, not like a new case to the area.
Okay, and now these 21 individuals, will they have to go to the hotels like before when there was outbreaks at the farms?
So our protocol has been to remove the high-risk contacts to hotels, and that did occur. And so the high-risk contacts were tested, and they were at a hotel under the cooperation with the owner.
Katie asked a similar question, but is this why Dr. Ahmed put out the updated information earlier this week? The health unit had a gut feeling something like this could happen?
It really is coincidental, so there was no kind of, anticipation of this particular farm, but all along we have known that the farms are at higher risk of transmission of the virus. And so the updating of the order was just necessary to update it, make sure we had encompassed everything. And so it was all a work in progress. And so the timing of it really was not very specific to this farm in any way. It's very applicable to all of the farms in our region.
I'm not sure, sorry, one more. I'm not sure if you can answer this, but the farm that is under outbreak, has this farm been under outbreak before?
We are familiar with the farm, but some of the operations have more than one operating facility under different names. So we're still working with the owner, but we are familiar with many of the farms. And as you know, at one time we had quite a few farms that even had cases, and we're not necessarily an outbreak. So I'm not sure about an outbreak, but we have worked with this farm before.
Okay, thank you. Sorry for the additional questions there.
No problem.
Any questions from the Windsor Star?
Rob and Katie covered them all.
Any questions from Blackburn?
Hi. Is any additional mass testing going on in any of the other farms locally, or is that pretty much over now?
Sorry, I didn't hear the actual question. Is there any additional
Mass testing going on in any of the other farms?
mass testing? Not that I'm aware of. So the farm operators are having active screening protocols in place, and anyone who is showing symptoms is asked to get tested, and they would be able to get tested. but no mass testing other than the testing that's being done by our health unit in response to this particular outbreak.
Good, thank you.
Any further questions from CBC?
Not right now, thank you.
AMA 100?
No, I'm good. Happy Thanksgiving, everyone.
Windsor Star?
I suppose since we do have our epidemiologist on the line, I was just wondering if they noticed any particularly noteworthy changes in trends this week.
Hi everyone, it's Ramsey. No, in terms of this week, our numbers have been low. What we've primarily been noticing outside of the agri-farm cases is most of our cases have been tied to close contact, which is beneficial in terms of contact tracing efforts that our staff have been working towards. So, but outside of that, no.
Okay, thank you so much.
Any further questions from Blackburn?
No, thank you.
Okay, thank you everyone. Happy Thanksgiving.
Thanks, everyone.
Happy Thanksgiving. Thank you.